an innovation perspective and a care delivery model perspective, we've had to rework all of our traditional care processes, and many of them have actually been reworked for the better. So most of it has been centered around COVID to ensure we're delivering a safe experience for the patient. We also need to ensure safety to our team that's delivering the patient care. And so when we see patients now, that's one of the primary things we do, which is appropriate screening of patients to determine whether the patient needs a different pathway in our care processes. And then we also make sure we separate the patients so that they're safe from other patients if there's a group that might have COVID or not. We've been very intentional with our approach with both the COVID patient population as well as the non-COVID population, and to the best of our ability, being able to manage those in separate environments. For patients that are stable and don't even need to get out of the car and they're there for screening purposes, we'll actually evaluate them while they're still in the car after we get vital signs and do some medical screening evaluations so that we can safely manage our patients that don't have COVID within the emergency department. So basically every pathway is built around ensuring that we are safe, the place is clean. There should be no fear that if you have an emergency or symptoms that you're concerned that might be an emergency, that you should feel very safe to come to our emergency department and get fast care. Many of the great work that you'll hear about coming out of Carolina's Medical Center is really implemented across all the emergency departments. So we make sure we're delivering the same high quality care and all these contingency mechanisms so that we decrease risk to all those that could potentially get exposed to COVID, and that is the same across all the emergency departments. Just know that we've done all of these measures to make sure that we can deliver you the highest quality of care. Whether you have COVID or whether you do not have COVID, know that we're going to make sure we can deliver the optimal care in either situation.